If you're over 60, there's a good chance the pain in your knees, hips, or shoulders is slowly stealing your freedom. And here's the scary part. Most seniors are told the only way forward is more pills, stronger painkillers, or even surgery. But what if I told you the real solution might already be hiding in your kitchen? As a health researcher who spent years studying senior wellness, I've seen the risks of long-term pain medication firsthand. Bleeding ulcers, heart strain, even kidney damage. That's why what I'm about to share today is so surprising. Type yes in the comments if you've ever felt trapped by joint pain or worried about the side effects of your medications. Here's the truth. Every single day, millions of seniors just like you wake up stiff, sore, and reaching for another pill. You probably believe that's the only way to cope, but it's not your fault. That's what we've all been taught. A simple spice, something you've probably sprinkled on food before, has been proven in clinical studies to relieve joint pain in as little as 2 weeks. And today, I'm going to show you exactly how it works, how to use it safely, and why it could make the next 2 weeks feel very different for your body. So stay with me, because what you're about to learn could change how you move, walk, and live. Let me paint a picture I know you'll recognize. You're sitting in your doctor's office, explaining how your knees have been giving you trouble getting out of bed in the morning. Maybe it's your hands that ache when you're trying to open that stubborn jar of pickles. Or perhaps it's your back that screams at you every time you bend down to tie your shoes. Sound familiar? Your doctor listens, nods knowingly, and reaches for their prescription pad. Within minutes, you're walking out with a piece of paper that's supposed to solve your problems. A prescription for NSAIDs. That's those non-steroidal anti-inflammatory drugs with names you can barely pronounce. Ibuprofen, naproxen, diclofenac, meloxicam. Now here's what I want you to think about for a moment. When your doctor handed you that prescription, did they sit down and explain exactly what these drugs do to your 60-plus body? Did they tell you about the hidden risks that come with taking them every single day? Probably not. And that's not necessarily their fault. They've got 7 minutes with you, 20 other patients waiting, and insurance companies breathing down their necks. But here's what happened next in your story. You took that prescription to the pharmacy, paid your copay, and started taking those pills daily. Maybe twice daily. You thought to yourself, finally, I'm doing something responsible about this pain. And you know what? For a while it felt like the right choice. The pain became more manageable. You could get through your day without wincing every time you stood up. You felt like you had your life back. Type 1 in the comments if this story sounds like your exact experience with joint pain. This whole approach seems perfectly logical, doesn't it? I mean, inflammation is what's causing that throbbing in your knees, that stiffness in your fingers. These drugs are literally designed to fight inflammation. Your doctor, someone with years of medical training, prescribed them. The pharmacist filled them without question. They work. What could possibly be wrong with this picture? Well, here's where this story takes a turn that most seniors never see coming. While you're feeling relief from your joint pain, something else is happening inside your body. Something your doctor probably didn't have time to fully explain, and something the pharmaceutical companies definitely don't advertise. Those NSAIDs you're taking daily, they're quietly, invisibly damaging your stomach lining. Every single pill you swallow is making microscopic tears in the protective barrier that keeps your stomach acid from eating away at your stomach wall. But it gets worse. These same drugs are increasing your risk of having a heart attack by up to 50%. Let me put that in perspective for you. If you're a healthy 70-year-old, your normal risk of heart attack is about 2% per year. Taking daily NSAIDs can push that to 3%. That might not sound like much, but we're talking about tens of thousands of additional heart attacks every year among seniors. And here's the part that really gets me fired up. Those drugs you're taking to protect your joints, they're actually accelerating the breakdown of your cartilage. That's right. The very thing you're trying to preserve is being destroyed faster by the medicine that's supposed to help. Think about the last time you had to choose between taking your pain medication or dealing with the side effects. Maybe your stomach felt queasy after taking them. Maybe you noticed your ankles swelling more than usual. Or perhaps you've been to the emergency room with what turned out to be medication-related complications. Type experienced if you've had any of these side effects from pain medications. Now, here's what makes this particularly dangerous for those of us over 60. Your body isn't the same efficient machine it was when you were 30 or 40. Your kidneys, those amazing filters that clean your blood, they have to work overtime to process these drugs. And after decades of faithful service, they're not as quick or as effective as they used to be. Your stomach lining? It's thinner now. You produce less of that protective stomach acid that helps shield you from medication damage. This means every NSAID you take hits you harder and stays in your system longer than it would in a younger person. Let me give you a scenario that might hit close to home. You wake up on a Tuesday morning, take your daily anti-inflammatory with breakfast just like you've been doing for months. You feel pretty good. The pain in your knees is manageable today. You can walk to the mailbox without grimacing. But while you're enjoying that pain relief, here's what's actually happening inside your body. That pill is telling your joints to stop their natural repair processes. It's like turning off the maintenance crew in a building that desperately needs upkeep. Meanwhile, it's irritating your stomach lining, potentially raising your blood pressure and putting extra strain on your heart. The cruel irony? You think you're protecting your ability to stay active and independent. But with every pill, you're potentially trading today's comfort for tomorrow's serious health complications. The immediate consequence feels great. Less pain, more mobility, better sleep. But the long-term consequence? You might be setting yourself up for stomach ulcers, kidney problems, heart issues, or joints that deteriorate even faster than they would naturally. And here's what really breaks my heart about this situation. You're making these trade-offs without anyone clearly explaining the risks. You're gambling with your long-term health, and nobody told you that you were even placing a bet. All right, let me explain what's really happening inside your body when you take those NSAIDs. I'm going to break this down in a way that makes sense, because once you understand this, you'll never look at these drugs the same way again. Here's the thing that shocked me when I first learned about it. NSAIDs don't just target the bad inflammation that's causing your pain. They shut down all inflammation in your body, including the good inflammation that your joints desperately need to heal and repair themselves. Let me give you a picture you can really visualize. Think of inflammation like a construction crew working on your house. Now, imagine some of the workers are causing problems. They're being too loud, making a mess, maybe even damaging some things. That's the painful inflammation you feel in your joints. A smart homeowner would fire just the troublemakers and keep the good workers who are actually fixing the roof, patching the walls, and maintaining the plumbing, right? But NSAIDs? They're like a frustrated homeowner who fires the entire crew. All the workers, the good ones and the bad ones, get sent home. Sure, the noise stops and the mess gets cleaned up, but now there's nobody left to maintain your house. Your joints are the same way. When you block all inflammation, you stop the pain, but you also stop your body's natural ability to repair damaged cartilage and maintain healthy joint tissue. Type repair. If you had no idea your joints were trying to heal themselves. Now here's what makes this even more concerning for those of us in our 60s, 70s, and beyond. Your body is already producing less of the natural substances your joints need to stay healthy. Think of collagen as the cushioning in your joints, and synovial fluid as the oil that keeps everything moving smoothly. After age 60, your body naturally makes less of both. It's like having a car that's already low on oil, and then you decide to disconnect the oil pump entirely. When you take NSAIDs regularly, you're essentially telling your joints to stop trying to repair themselves. At the exact time in your life when they need the most help, you're shutting down their maintenance system. And if you're dealing with other health conditions, like diabetes, heart disease, or high blood pressure, and let's be honest, about 80% of us over 60 are dealing with at least one of these. NSAIDs can make every single one of these conditions worse. They can spike your blood sugar, raise your blood pressure, increase your risk of blood clots, and interfere with medications you might be taking for other conditions. It's like trying to fix a leaky roof by removing the entire roof. Sure, you stop the drip, but now you've got bigger problems. Okay, so after hearing all of this, you're probably wondering, what do I do with this information? First, let's talk numbers you need to remember. If you're taking NSAIDs more than 3 days a week, or if you've been on them consistently for more than 6 months, your risk of serious complications starts climbing significantly. Now, I want to be crystal clear about this. If you're currently taking prescription NSAIDs daily, please don't just stop cold turkey after watching this video. Your body may have become dependent on them for pain management, and sudden withdrawal could leave you in significant discomfort. But here's what I do want you to do. Have a conversation with your doctor about what I'm about to show you in the next part of this video. Print out the research I'm going to share, take it with you to your next appointment, and ask if there might be safer alternatives for your specific situation. Type "tired" in the comments if you're absolutely exhausted from having to choose between living with pain and dealing with dangerous side effects. Let me know you're out there. I want to see how many of you are struggling with this exact dilemma. And if this information is opening your eyes to something you hadn't considered before, give this video a thumbs up. It genuinely helps other seniors find this content, and there are thousands of people just like you who need to hear what I'm sharing today, because here's what's coming next. I'm going to show you the simple, natural alternative that clinical studies prove works just as well as prescription drugs, but without any of these dangerous side effects. And the best part? You probably already have it in your kitchen cabinet right now. Stay with me. This next part could literally change your daily comfort and your long-term health. I know this is frustrating. You trusted your doctor, you followed the prescription, and now you're learning it might be causing more problems than it's solving. The good news is that there's a natural solution that clinical studies prove works as well as prescription drugs, but without the dangerous side effects. The answer isn't in your medicine cabinet, it's in your spice cabinet, and it's been hiding in plain sight for centuries. Alright, are you ready for this? Because what I'm about to tell you might make you want to march straight to your kitchen cabinet after this video. The spice that's been quietly sitting in your pantry, probably right next to your salt and pepper, is turmeric. That golden yellow powder that you might sprinkle in your curry or use to make those beautiful golden milk lattes. Now, before you roll your eyes and think, "Oh great, here comes another folk remedy from someone's grandmother," hold on just a minute. I'm not talking about old wives' tales here. I'm talking about hard, peer-reviewed science that would make your doctor sit up and take notice. The magic isn't just in the turmeric itself, it's in a specific compound called curcumin. Think of curcumin as turmeric's superstar ingredient, kind of like how vitamin C is the powerhouse in oranges. And here's where it gets really exciting. In 2021, researchers did something pretty remarkable. They took 11 different randomized controlled trials. That's the gold standard of medical research, by the way, and analyzed the results from all of them together. What they found will blow your mind. Turmeric extracts reduce knee pain just as effectively as prescription painkillers. Let me repeat that because it's so important, just as effectively as the drugs your doctor is prescribing. But here's the part that got me really excited when I first read this study. It didn't just mask the pain like NSAIDs do. It actually helped heal the joints while providing relief. Type "amazing" in the comments if you had no idea a simple kitchen spice could be this powerful. Now, I know what you're thinking. This sounds too good to be true. How long does it take to work? Months? Years? Here's where the research gets even more impressive. In a specific study of 139 seniors with knee osteoarthritis, people just like you dealing with real, daily joint pain, participants took 500 milligrams of curcumin 3 times daily. The results? Significant pain relief within just 14 days. 2 weeks. That's faster than many prescription drugs take to reach full effectiveness. And get this, the pain relief was comparable to those taking diclofenac. That's a prescription NSAID that costs about $150 a month and comes with all those dangerous side effects we talked about earlier. Think about that for a moment. These seniors got the same level of pain relief from a natural spice that they were getting from a prescription drug. But instead of risking stomach bleeding, heart problems, and kidney damage, they were actually supporting their body's natural healing processes. Now, here's the science behind why this works so much better for people our age. Remember how I explained that NSAIDs are like firing your entire repair crew? Well, curcumin is like having a really smart foreman who only gets rid of the troublemakers while keeping all the good workers on the job. It selectively targets only the harmful inflammation, the kind that's causing your pain and stiffness. But it leaves alone the good inflammation that your joints need to repair cartilage, produce synovial fluid, and maintain healthy tissue. For those of us over 60, this is absolutely crucial. Our bodies are already working harder to maintain our joints. We don't need something that shuts down our natural repair systems. We need something that supports them while giving us relief. Dr. Janet Funk, a researcher at the University of Arizona who spent years studying curcumin, puts it this way. Curcumin appears to work with your body's natural healing processes rather than against them. For older adults, this can mean the difference between managing symptoms and actually improving joint health over time. Type healing if you're excited about the idea of actually helping your joints get better, not just covering up the pain. And here's something that really impressed me about this research. They didn't just measure pain levels. They looked at how well people could function in their daily lives. Seniors taking curcumin reported better sleep, easier movement in the morning, and more confidence in their ability to stay active. One 72-year-old participant in the study said, "For the first time in years, I wake up and don't immediately think about how much my knees are going to hurt today." Can you imagine what that would feel like? Waking up and having your first thought be about what you want to accomplish that day, instead of worrying about whether your joints will cooperate? But here's where most people make a critical mistake when they try turmeric for the first time. They either use too little, use the wrong form, or, and this is the big one, they don't know the absorption secret that can make or break your results. And that's exactly what I'm going to share with you next, because without this one crucial piece of information, you might try turmeric and think it doesn't work, when really, you just weren't using it correctly. The absorption secret coming up could be the difference between getting amazing results in 2 weeks or getting no results at all. Margaret, a 74-year-old grandmother from Ohio, couldn't pick up her grandchildren anymore because of the stabbing pain in her knees. She'd been taking prescription NSAIDs for 3 years. After switching to a bioavailable turmeric supplement, she noticed less morning stiffness within a week. By day 14, she was playing on the floor with her grandkids again. Her pain scores dropped from an 8 out of 10 to a 3 out of 10. More importantly, she could walk upstairs without gripping the handrail for the first time in years. As Margaret told me, "I got my life back from a simple spice. I wish I'd known about this years ago instead of suffering through all those side effects." The research shows the optimal dose is 500 to 1,000 milligrams of curcumin daily, taken with meals to improve absorption. Here's the crucial part most people miss. Curcumin alone isn't well absorbed. You need to take it with black pepper extract, called piperine, which increases absorption by 2,000%. Take your curcumin supplement with breakfast, lunch, and dinner. Or, if you prefer natural methods, make golden milk. 1 teaspoon turmeric powder in warm milk with a pinch of black pepper. If you're worried about the taste, start with capsules. If you're concerned about interactions with your medications, turmeric is generally safer than NSAIDs, but always check with your doctor first. The best part? A month's supply of quality turmeric supplements costs about $15, less than what most seniors spend on prescription copays. Knowledge is your best medicine. You now know something that could change your daily comfort and long-term health, something your doctor might not have time to research or discuss. You're never too old to take control of your health naturally. At 60, 70, or 80 plus, your body still has an amazing ability to heal when you give it the right support. Tell me in the comments, what's the first change you're going to make after watching this video? Are you going to try turmeric, or do you have questions about getting started? If this opened your eyes to natural solutions that actually work for seniors, subscribe for more honest, research-backed health advice that puts your well-being first, not pharmaceutical profits. What other natural remedies have you tried for joint pain? Share your experiences below. Your comment might help another senior find relief.